There seems to be a lot of confusion as to what these different numbers mean when you're talking about medical tests. So people are talking about accuracy, talking about sensitivity, specificity, and all kinds of different things. And most importantly, it seems that there's a lot of people who are confused as to what it means to have a positive test. And some people are even talking about issuing some positive test certificates as if this was going to give you some certificate of immunity to the disease. So let's talk about that for a second. Let's start by looking at the total population of a country. Some disease comes by, and all of a sudden, we have a certain proportion of that country which is composed of infected people. The rest of the country is not infected. You don't exactly know what that proportion is, but you have some estimate of what that might be at any given point in time. So the width of the box in yellow is the percentage of people who are infected. The total width of the box corresponds to 100% of the population. Now let's say that some pharmaceutical company developed a test, and the test has certain numbers that they give you. In particular, they give you sensitivity and specificity. Sensitivity is the percentage of people who test positive for a test, given that they are infected. That means that if you give the test to a population entirely composed of infected people, there's always going to be a small proportion which is going to test negative, but the vast majority of them are going to test positive in the test, which is what you would expect for a good test. Conversely, specificity is a percentage of those people who test negative, given that they are not infected. So if you test a population that you know is not infected, there's a certain percentage of those tests which are going to test positive. Those are called false positives. And the rest of those are going to test negative. And the proportion of people who test negative, if they are not infected, is going to be much higher than the proportion of people who test positive. That's what you would expect from a good test, once again. So these two numbers, sensitivity and specificity, are very important because this is going to be the main thing you're going to look at when you're trying to determine what it means to have a positive test. What do I mean by that? Well, if you look at this box, just try to see who are the people who are testing positive. That's all the people in that red box right there. All the positive tests are in that red box. And that's kind of interesting because notice how much of that shape is colored blue, by which I mean it's composed of non-infected people. In fact, let's rearrange things a little bit. The yellow boxes are the same size. The blue boxes are the same size. Now, I don't know if you can tell, but it seems that there's just about as many people who are infected who test positive as non-infected people who test positive in this particular scenario. This is the basis of Bayesian analysis statistics. So let's give a real example, a real world example. Let's plug in real numbers, assuming that 1% of the population is infected with the coronavirus. Now, the latest antibody test has been rated as having a sensitivity of 93.8% and a specificity of 95.6%. If you remember, sensitivity is a number of people who test positive given that they are infected, and specificity is the number of people who test negative given that they are not infected. So we assume that only 1% of the tested population was infected. Well, a quick aside, this is a very accurate test. The accuracy of this test is very high. All of these are accurate results, meaning people who are infected who test positive and people who are not infected who test negative. In fact, this is a test which is 95.58% accurate. Well, that's great, you might say. Well, yes, but it kind of depends on what you're looking for. So let's get back to this. Sensitivity is 93.8%, specificity is 95.6%. Well, this is the number of positive tests that we have. Well, the first thing you might notice is that, well, there's just not that many true positives there, especially when you compare them to the number of false positives. In fact, if only 1% of the tested population was actually infected, it's highly likely, 82%, that a positive test is actually a false positive. And note, the accuracy of the test is still 95.58%. So let's assume that the virus becomes more prevalent, with the infection rates in the population rising from 1% to 5%. So now 5% of the tested population was infected. Note that the accuracy changes a little bit due to the population change in infection rates, but it will always remain between sensitivity and specificity. Because sensitivity and specificity of this test is very good, both of them, the accuracy is not going to change very much, but it is variable depending on what percentage of the population actually is infected. Well, let's look at what happens there. So 5%, that's 5 times more of the population was infected than before. Well, look at this. Number of true positives becomes this. Number of false positives becomes that. And what you can see is that, well, you basically have even odds of actually having been infected if you test positive. The accuracy is still 95.51%. But you only have a 47% rate of false positives to the overall number of positive tests. That's better than what you had with 1%, where you have 82% rate of false positives to total positive tests, but it's still pretty high. You have even odds. Now, note that at 5%, the upper bar is bigger than the lower bar, because obviously, if you have 5% of the population which is infected, you expect to have more frequent positive tests. In fact, the number of positive tests that happen is almost entirely due to the fact that you have more true positives that occur. The number of false positives actually decreases a tiny bit compared to what you had at 1%, but not by much. So, based on that, is there any point to testing? The answer is yes, with a caveat. So, for instance, let's look at this. Before you got tested, you estimated that you had a 1% chance of being infected at any given point in time. So you go and take a test. After the test, you had an 18% chance of being infected if you got a positive test. So getting a positive test means something. In particular, if you test positive, you should double down on all social distancing measures in order to protect others. It's not so much about you being protected from others, it's about you protecting others. Because now your risk is 18 times higher than what you thought it was before you got tested and got a positive result. Now the other thing as well is that this tells us how to give the test properly. And that's what they do in the medical community. Before they give you a test normally, you would want to check whether they actually had symptoms or whether they had direct exposure with somebody who was known to have COVID-19. Well, let's say that because of those prerequisites, your probability of having been infected rises to about 15% out of the population that gets tested. Then what happens? Well, number of true positives is now much bigger than the number of false positives. But it's still not impossible that you haven't been infected. So you got to be careful with that. Just because you got a positive result, even if you have a proper history, doesn't guarantee that you are immune from the virus, even if having a true positive was a guarantee of having that virus in the first place. So is there any point to testing at this point? Yes, there is, but it has to be done properly and for the correct reasons. Is there any point to issuing positive test certificates to certify immunity? Well, maybe. But only in areas where there has been a high rate of infection, such as New York City or New Jersey, only if issued by a doctor after reviewing the patient history in order to make sure that the prior probability of having been infected is high enough that the test means something. And most importantly, it cannot be issued just for getting a positive result on an antibody test.